Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
Happy Easter, ladies and gentlemen, because we have quite a few male followers on the Ask Dr. Angela podcast. But anyway, happy Easter. This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 93 of the Ask Dr. Angela podcast. So, did the Easter Bunny visit your nest? The Easter Bunny certainly visited our haven, and we love the Easter Bunny. Love Easter dinner, Easter candy, Easter baskets, and the Easter Bunny just seems to get more and more grand. My little girl woke up this morning and she had a note from the Easter egg with an egg leading her on a hunt all over the house. And of course she found not only a bunch of eggs filled with goodies, but a grand Easter basket with even more goodies. She was like, "Thank you, Easter Bunny. Doot, doot." Does anybody remember that Cadbury Easter egg commercial? Well, anyway, that's what they used to say. I loved that commercial. Did not, however, love Cadbury candies. I think it was chocolate with cream in the inside. Ugh. Anything with cream in the inside, not such a fan of. What are some of your least favorite Easter candies? Those Cadbury eggs, what are those? Those Peeps, those marshmallow candies. As my little girl says, hate those. Anyway, I hope that everyone had a festive holiday and, of course, remembers the reason for the season. Let's jump right into today's podcast topic. I think that I recently informed you that I now have the esteemed pleasure of being a featured expert on The Bump. So I'm super excited about that. But one of the questions that I was recently posed from there has to do with dental visits and x-ray exposure during pregnancy. And that's a big topic for a lot of people. First of all, visiting the dentist. If you need to go, get your teeth cleaned. If you have a cavity or, an infected tooth, you definitely need to have that addressed because any source of infection during pregnancy is never, I'm going to say that again, never a good thing because infection leads to preterm labor. It doesn't matter whether the infection is arising from your bladder, your mouth, the inside of your uterus. Infection from any source is never good. So please go to your dentist and make sure that your oral hygiene is where it needs to be. If you do happen to need some surgery or a minor procedure done, in most instances, you can get these things done during pregnancy. I know that my office, and I'm sure that most of your OBGYN's office have a list of medications that you can safely take during pregnancy or that can safely be administered during pregnancy. So please don't suffer. If you have a tooth that needs to be addressed, go to the dentist. Now, part 2 of this question, x-rays during pregnancy. X-rays, for the most part, are safe during pregnancy. Specifically, if we're going to talk about dental x-rays, I had to do a little bit of research on this just so that I could get the numbers just right for you. But in the back of my mind, I knew that ACOG would stand with me on this. And ACOG, of course, is the American College of OBGYN. So ACOG and multiple other radiological sources have said that any exposure of less than 5 rats is not associated with fetal anomalies or increased pregnancy loss. So to kind of put that in perspective for you, a dental x-ray emits about 0.001 rats. So to make that even more simple, you would need approximately 50,000 dental x-rays done in order to equal a 5-rat dose. Say cheese, click, click. So here's the hoping that today's podcast topic has benefited someone. Thank you so much for tuning in. Go enjoy your Easter dinners, your Easter candies, etc. For those of you that have a topic or a question that you would like featured on the Ask Dr. Angela podcast, please go to www.askdrangela.com. That's drangela.com, or you can direct message me on Twitter at Dr. Angela OBGYN, or you can direct message me on Facebook. Ask space Dr. Dr. space Angela, Angela. Questions are coming. Please keep them coming. Love all of the interaction. I love seeing you all post your fantastic pics wearing your Look Better, Feel Better, Be Better t-shirts. Those are bomb-ass t-shirts that we give away if you happen to have a question featured on the Ask Dr. Angela podcast. So again, submit. And if we use your question, someone from my team will definitely reach out and we'll get you one of those t-shirts. In closing, I would like to leave you with this thought from Colin Powell. A dream doesn't become reality through magic. It takes sweat, determination, and hard work. I love this quote by Colin Powell because it reminds me of something that my dad says to me all the time. My dad's the pastor of a very large church in Cincinnati, Ohio, and he always says to me, you know, Ange, we all know that the good Lord is capable of miracles, but he certainly expects you to do your part. So let's do our parts, people. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 94. Have a great day.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.